So we're going to start off our afternoon, I think, with a really appropriate segue from lunch to nutrition. So I'm delighted to introduce KateMathias, who is an advanced practice registered dietitian who provides specialty care to patients specifically with head and neck cancer at the Stanford Cancer Center. So she probably knows a number of you. She brings a blend of science and patient-centered care to her practice, and we are just really delighted that she has joined our team, and she's really changed a lot in terms of how people experience things as they go through treatment. So, Katie, we're delighted to have you here today. Come on.
Hi, good afternoon. And Heather stole my line. I was going to say, perfect segue after lunch. We've all eaten, and it was a delicious lunch. So I'm happy to segue into nutrition, and we'll be talking about nutrition during and after cancer treatment. So my presentation today, I'll talk about nutrition and malnutrition risk. I'll cover the role of the dietitian on the treatment team. We'll talk about nutrition goals and recommendations through treatment, symptom management through food safety, and survivorship nutrition. Approximately 40% of patients present with malnutrition and some degree of weight loss and unintentional weight loss prior to diagnosis. This can be because of decreased appetite, maybe a poor appetite, inflammation from cancer due to increased nutrient needs, heavy alcohol or tobacco use, tumor involvement that can impair chewing or swallowing ability. During treatment, there's also an increased risk of malnutrition. It can be from various side effects that you may experience or from post-surgical changes from this possible surgery that you might have had. The dietitian plays an important role on the treatment team, and it's important for us to help patients maintain their weight during treatment. Research has shown as little as a 6% weight loss during treatment has been associated with reduced quality of life, more breaks from treatment, prolonged healing time, increased hospitalizations, reduced overall response to treatment, and poorer treatment outcomes and prognosis. The dietitian also helps with nutrition strategies to help with side effects during and even after treatment, as well as education on food safety precautions if it's appropriate with the treatment that you're on. Adequate and balanced nutrition is a key factor in maintaining the body's physical and functional ability to withstand treatment interventions. The body has higher nutrition needs for many reasons. Cancer cells do need energy to survive, so you may notice that your body is burning more calories than it normally would at rest. An inflammatory process like cancer also causes an increase in nutrition needs for carbohydrates, proteins, and fats more than it normally would. So in the example here, you can see that for general health, this patient needed about 1,900 calories and about 60 grams of protein. During treatment with the rise in their nutrition needs, they needed about 2,500 calories and 115 grams of protein. So you can see that it is drastically different. There's much more nutrition that your body needs while you're in treatment and after for healing and recovery. So to quickly summarize, it's especially important to focus on nutritious foods to feel better and provide your body the nutrients it needs during treatment. Cancer cells need energy to survive, so your body may burn more calories at rest than it normally would. The body also uses more calories due to stress to help repair damaged cells and tissues and to rebuild muscle, and then to also fuel your healthy cells as well. So this is really not the time to start or begin a diet or continue a diet if you are on one. It's really best to just focus on those high calorie, high protein foods to help meet your nutrition needs while in treatment. So during treatment, there are a couple different nutrition strategies that have been helpful to give you kind of a success going through treatment. So I think we've heard a little bit of, when we were talking about some of the side effects earlier this morning's talk, smaller, more frequent meals. Many patients find that that's just a lot easier for them to eat the nutrition they need throughout the day versus these really large portions that maybe they're feeling too full too quickly, maybe they're just feeling nauseous, or maybe it's just too challenging to chew something that, these large portions. So breaking their meals into smaller, more frequent meals can be really helpful. And then making every bite and sip count. So really choosing high calorie, high protein foods and beverages so that even if you're doing these multiple small meals throughout the day and you're just taking small bites, every bite is really high calorie, high protein wherever we can. Choosing softer or more easy to chew and swallow foods of course, can be definitely beneficial for many reasons. We'll talk about side effect management and some other tips for softer and easier to chew foods, but that can be much easier to get down than something that's really crunchy or tough to eat. Choosing lower acidic or less spicy foods definitely can be helpful depending on different side effects that patients are having, but specifically with mouth sores, that can be something that can be helpful. Avoiding alcohol also can be really helpful too because it is quite irritating for the mouth as well as pretty drying too. So as we learned earlier, some of those side effects like mouth sores and dry mouth can benefit from avoiding alcohol. Supplementing our diet, some patients find that adding protein powders to different foods and beverages can just be a nice way to get those extra calories and protein that they need. And we'll talk more in a few slides on just a little bit more of the specifics about some of the other supplements. And then lastly, maintaining excellent oral hygiene. So the team will probably go through some kind of baking soda salt rinses or maybe some kind of special rinses after surgery, just making sure that we're doing all those recommendations, brushing our teeth, keeping our mouth very clean. All of that can be very helpful for things like dry mouth, mouth sores, taste changes, and of course, prevention of dental caries too, which we want to make sure we continue to do that as well. So as I mentioned earlier, nutrition is very important during and after treatment. It's to help support your healing that your body is going through during treatment as well as the healing it will be doing after treatment as well. So your nutrition needs are elevated, and it's important to focus on adequate intake to help repair those body tissues. So protein is important for that. It also helps maintain our muscle mass, supports our immune system. So when we're sitting down to eat, really making sure each meal and snack or all of our small frequent meals have a good source of protein. So some sources of protein that can be soft or kind of easy to grab are things like lean meats, poultry, fish, eggs, tofu, dairy foods are all nice options for proteins, as well as some protein powders and liquid protein drinks that are listed here. And then I always like to make sure I follow up with just keeping in mind that it's great to eat nutritious foods, and we want you to do that. If that becomes too challenging while you're in treatment, please just rely on those foods that are, highest in calorie, highest in protein that you can tolerate, versus something that might just be deemed healthy. Right now, we just want to make sure while you're going through treatment, we want to get those calories in to keep our weight as stable as we can. And then I forgot to mention, I do have my slides on the front table too. So if that's helpful for anybody to grab slides. Carbohydrates and fats also help support the bulk of calories our body needs to maintain our weight. Carbohydrates provide vitamins and minerals. Fats provide fatty acids and help with the absorption of those vitamins and minerals. So some good sources of carbohydrates are fruits, starchy vegetables, grains, and dairy. While I say that, some of those can be challenging while you're in treatment. So maybe it's avoiding certain fruits that are more acidic. Maybe it's choosing more soft things like mashed potatoes or dairy foods like yogurt or cottage cheese. Some good sources of fats are things like avocados, avocado oil, olive oil, creamy nut butters, and fatty fish like salmon. Vitamins and minerals are also helpful to ensure proper growth and development of our cells and are important in energy metabolism as well. Usually, if you're consuming a well-balanced diet, you probably don't need to worry about supplementing with any kind of vitamins and minerals. But I do get asked frequently, should I be taking something? Should I be taking a supplement? Typically, I say no, you probably don't need to be starting a supplement during treatment. Most often, the team wants you to either stop, avoid, or really look at what you might be taking for herbal supplements, even vitamin supplements as well. Some of them can interfere with how treatment is absorbed. So for instance, antioxidants or really high dose antioxidants can interfere with radiation and chemotherapy. And so we really want to make sure if you're on those treatments that they work as best as they can. So typically the team will have you hold taking something like that. Some supplements can interfere with our liver function and the way our body metabolizes the chemotherapy drugs. So having you stop some of those medication or supplements as well. And then sometimes they can interfere with how our body forms blood clots. So I usually say at the end of the day, we really just want you to let your team know everything that you're taking. So all the supplements that you are taking, and that way the team can be the best judge of that. Should you continue this? Should you hold this? Is this something we can resume once you're done with treatment? And then of course, hydration is also very important. We really do want to make sure we're staying hydrated during treatment. Very, very important for our liver and our kidney health, especially if we're on chemotherapy. But the other part of hydration is that it really can help with some of the side effects too. So for fatigue, constipation, appetite, nausea, and dry mouth as well. So just very important to stay hydrated. During treatment, many patients find that soft, easy to chew foods can be more helpful due to the side effects they may be experiencing. Homemade smoothies or milkshakes can be really helpful. I just always say, when you're making your smoothie or milkshake, what's the source of protein? Is it milk? Is it a protein shake? Is it protein powder, yogurt, silky tofu? What's that protein source in that meal? Some ways you could add calories would be coconut cream, or even nut butters or avocado would be some nice additions to your shakes. Soups are another great way to get some good calories in as well. So you could think about adding avocado, a drizzle of olive oil, an unflavored protein powder, or even sour cream to your soups, or even something like a lentil or beans kind of ground into for some added protein. Casseroles with soft pastas and cheese and ground meats can be another great option for something soft that's easy to chew but also has some good calories and protein to them. If you've met with me before, you know I always talk about the salads, the chicken salad, tuna salad, egg salad. Just always a really nice option for a meal or a snack. Not only are they high in protein and soft, but you really can make them more high in calorie by adding extra mayonnaise, maybe squishing in some avocado, some hummus, something like that, to really elevate it, to give it some more nutrition as well. Refried beans, guacamole, sour cream can be a really nice option too. Nice and soft, as well as scrambled eggs, French toast, quiche, something like that could be another great option as well. Making the switch to a fuller fat dairy, so yogurt, milk, cottage cheese, can we add some more calories by just switching to higher fat? And then high calorie protein shakes, which we'll talk about in a little bit. So if it is becoming more challenging to eat during treatment, you might need to think about supplementing your diet with a protein powder or a protein shake. I usually just say try to find something with 300 calories and 15 grams of protein per serving. There's many different shakes out there on the market, but some can be pretty low in calories. There's a couple out there with 150, 160 calories. But as you could see in that example earlier, if you needed 2,500 calories, for example, you would need many shakes if they're that low in calories. So that's just always kind of a good ballpark for if you're at the store and looking for something. I always want to mention too, just consider where you're buying your supplements as well. There's no regulations surrounding the supplements or the ingredients in supplements. So if you can, purchasing something with third-party testing can be a good indicator if it's a safer product. They usually have some kind of a certification label, usually good manufacturing practices, the United States Pharmacopoeia, or the National Sanitation Foundation can be some good labels to look for on that packaging. Some of the supplements that the Stanford Cancer Center dietitians may recommend, or you may have seen this in some of the handouts, are Kate Farms 1.4, Ensure Plus or Boost Plus, Boost Very High Calorie, 2Cal HN, Emu, or Soylent are just a couple options that we tend to kind of find that patients tend to like maybe the taste a little better. Some of these you can purchase in store, some of these need to be purchased online. And then protein powders is just another option as well. So sometimes that can be, patients might want to make their own shakes instead of doing a liquid protein shake, maybe adding a protein powder to something like their soup, their mashed potatoes, their cream of wheat. So I usually say try and find something unflavored. That can just go a little bit longer than if it's flavored like vanilla or chocolate. Some of the brands that we tend to recommend are Undri, Beneprotein, and Orgain. Tend to be some nice ones that you can't usually tend to tell that they're in the product that you're mixing it in. Food safety is also very important, especially if you're on chemotherapy. So ensuring that you're washing your hands well, we're definitely doing 20 seconds of hand washing. It says before eating, so definitely before eating, but after the bathroom, taking the trash out, touching the dog, all of those things, it's important to keep our hands clean. Making sure to wash our produce before we're cutting into it, wiping down the countertops, just making sure all of our surfaces are clean. When you're purchasing dairy and eggs, making sure they're pasteurized while you're in treatment. And then again, just making sure you're keeping aware of what you're making, label it before you put it in the fridge so that you know it does have a shorter lifespan. We just want to make sure we're not eating something that's expired. And then avoiding cross-contamination. So again, keeping our surfaces clean. We don't want to be cooking something with raw chicken and then cooking, chopping our carrots right after that. So just keeping some good clean practices in the home. And then the chart here lists the temperatures we would want you to cook your meats and poultry and fish to, just to make sure they're safe to be eating. Okay, so next we're going to talk about some of the symptom management and the nutrition tips that go along with it. So dry mouth can be a symptom of radiation, and soreness in the mouth can be a symptom of radiation and chemotherapy, and of course with post-surgery as well. So making sure that we're staying adequately hydrated. That definitely can help with how our mouth feels and the mouth dryness. And I know, sipping throughout the day can be really helpful, especially when you're speaking more. If you're eating, it definitely can help get the food down a little bit easier. And by hydration and fluids, it doesn't have to be plain water. There's many other things that we can be drinking: milk, coconut water, juice, Gatorade, herbal teas. All of those are some good fluids as well. It's important to also modify the consistency and the texture of things. Can you add a sauce to something? Could you drizzle on some olive oil? Can you add pesto? Something to give it a little bit more moisture to what you're eating, or a little extra broth to your rice. Something like that might make it just a little bit easier to get down. I've had many patients say the kind of swishing around a little bit of olive oil or coconut oil in their mouth, just to kind of coat their mouth to protect some of the dryness that they're feeling, can be kind of a temporary relief for them. And then, of course, limiting foods that are acidic, spicy, crunchy, dry, even temperatures like very hot things can be irritating for the mouth as well. So just being mindful of those things. Taste changes, I know this was brought up earlier today too, so it can be one of the hardest symptoms to manage, I think, because we all experience taste differently. So sometimes some patients might say things taste metallic or bitter, salty, or no taste at all. So it really there's quite a range of how we experience taste during treatment, after treatment, as we're healing. So if things are tasting metallic, just some of the tips that have maybe worked for some other people. Avoiding putting metal in your mouth. Can you switch to a plastic or a bamboo silverware, something else that's a little bit different that might not kind of give that metallic taste? Sometimes adding a little sweetness can kind of cut that metallic flavor a little bit. So it kind of depends on what it is. Sometimes it could be everything. Even your water tastes a little sweet. So can you splash in a little Gatorade or a little juice, something to kind of change the flavor a little bit. Recently, a patient of mine had said steak or meat was very metallic tasting, but he found if he added a little barbecue sauce, that it worked really well for him to get it down, just because there's that little bit of sugar in there too. Adding a little extra flavor can sometimes enhance the food that you're eating. So whether it's a little bit of like an herb, a mild spice, maybe a little extra sugar or sweetness to something that's already sweet, or a little salt to something that's savory, can kind of enhance those flavors, give it a little bit more flavor where you might be able to notice the taste of it a little bit better. Modifying the food temperature, so kind of many of my patients find room temperature to be the easiest kind of to eat and not as irritating for their mouth. Sometimes that can also just change how things taste as well. I do have a lot of patients find that bland ends up working better for them. Sometimes these big, bold flavors have big off flavors for them. So maybe doing more bland things during a period of time where taste is really challenging. So that could just be, mashed potatoes with, like butter and gravy and just kind of not big flavors of things, just so it doesn't have as off of taste. Some patients find, depending on if they have, if you have mouth sores, definitely the sugar-free candies are probably pretty irritating. But some patients who are quite a ways out, their mouth sores have healed, just a sugar-free candy that they can suck on kind of helps put a different flavor in their mouth instead of like the off taste that they might be having. Recently, I've had a few patients find success with, maybe they can, as their taste is returning after treatment has ended, maybe they can taste sweet a little bit better than savory. And they find that ending their meal with a bite of something sweet, a bite of a fruit, a bite of a fruit yogurt, something with a little extra of that thing that they can taste better, can be a little bit more palatable for them, leave a better taste in their mouth. And then I should have added it here, but the baking soda salt rinses, if that's something that your team has been having you do, just rinsing your mouth after you're eating, definitely before and after, can just also be really helpful with taste changes. Just keeping our mouth really fresh and clean can help. So nausea and vomiting definitely is a common side effect of chemotherapy. So back to those smaller, more frequent meals, that can just be really helpful when we're having nausea. So sometimes if we have this giant plate of food, if we're already feeling nauseous, just putting too much in our system at once to try and digest can just be a little off-putting. So things that are smaller, more frequent, eating every 2 hours is typically what I recommend, just to make sure we're not going too long without eating. That's when we can start to get queasy and just have more of an upset stomach as well. Choosing foods that are more bland, just easy to digest. So things like soft cooked chicken, oatmeal, eggs, crackers and rice, things that can just be a little bit more bland can be helpful if you're having nausea. Things that are hot that have a strong aroma or a strong odor can sometimes be really off-putting. So again, a room temperature item might be a little bit better. And just ventilating the area that you're eating. So making sure, maybe if someone's cooking in the kitchen, maybe you don't want to eat in the kitchen just because there's so many smells in there if you're already feeling nauseous. Maybe, oh my gosh, maybe eating outside or stepping away from the kitchen just so you're not in that room where those smells are as heavy. Avoiding and limiting rich foods, fried, greasy, heavy foods can just be really challenging if you're already nauseous. If you're having vomiting, we really want to make sure we're definitely staying hydrated, making sure we're getting adequate fluids, and then as well as hydration is also important for constipation as well. So if we're constipated, it tends to worsen our nausea. It also can impact our appetite. So again, just making sure we're staying hydrated can really help a lot of these other side effects. So nutrition remains elevated post-treatment to help with healing or recovery. So your body does have very high nutrition needs. It can be for months as well. So once you've completed treatment and have transitioned back to kind of more normal eating, stabilized your weight, it might be a time to start thinking about just cancer prevention, cancer survivorship strategies. So all the tips listed here are not to be done all at the same time. They're just goals that kind of working towards as you're starting to feel better, feel able to, and controlling our highest risk factors first. Can we cut back on, or can we work on tobacco cessation, limiting our alcohol intake? Those are going to be something that's very important. Next, can we think about maintaining a healthy body weight? And then start thinking about physical activity. Recommendations are about 150 minutes per week. Start thinking about, ways to implement our more fruits and vegetables, fiber, and color into our meals. So again, this isn't something that's intended to be once treatment's immediately over, but could be months and months down the road. Limiting red meat, really choosing more of those lean cuts of meat, more of the chicken, fish, poultry, and things like that. The guidelines are to avoid processed meats, trying to keep it to 18 ounces of cooked meat or less per week. And adding more of those healthy fats, seeds, nuts, healthy like salmon, fatty fish, trout, things like that to our meals. Wherever we can, switching over to whole grains. Could we eat, switch to steel cut oats or oatmeal versus our cream of wheat? Could we add in some different kinds of whole grain rice, barley, things like that to our soups, just to get in a little bit of more fiber to our diet? And then limiting sugary foods and added sugars. Can we add natural sugars from fruits and things like that instead of adding more sweets and things to our diet? I listed some resources here. I think we've seen a couple of these listed already. The Cancer Alliance, the Cancer Institute are great resources for head and neck resources pertaining to head and neck. The other ones I listed here, the complementary and alternative medicine, the botanical website, can just be nice to reference some of the supplements. They also talk a lot about the safety and the research behind those, so that can be really helpful. There's a website here, the Oli Foundation. If you're on tube feeding, that's a fantastic resource to be aware of. The recipes links here, the Cook for Your Life is a great resource because you can kind of filter for the side effects that you're experiencing. So these recipes will then be filtered if you click easy to swallow, taste changes, nausea. It'll kind of give you a bank of recipes that might fit the side effects that you're having. The books listed here are a great resource as well. These are all made with kind of cancer side effects in mind. So the nausea, some of them, the last one here, Cooking for Chemo, talks about mouth sores as well. So it can be a really nice resource to have. And if you haven't already, the Stanford Health Library at 875 Blake Wilbur is also a fantastic resource as well. So if you're over in the building, it's just good to take a walk through and see what resources that they have there. Okay, thank you.